In the assessment of metatarsalgia, we're routinely looking for neuromas and non-neuromatous lesions. And non-neuromatous lesions have gotten a lot more attention now that we have a greater understanding of the plantar plate and its biomechanics. So whereas neuromas are felt to be something that would be centrally located within an interspace, that its enlargement may be secondary to compression against the deep transverse intermetatarsal ligament. In contrast, these non-neuromatous lesions may be eccentrically located, as you can see here, that there is some kind of enlargement of the interdigital nerve and that there's some pericapsular inflammatory change that's occurring that's closer to the second metatarsal head, better seen here as it obliterates the fat on T1 weighted image. And that can be helpful. The T1 weighted image can help us see that cellular inflammatory response that's occurring here. So whereas Morton's neuromas would be centrally located, these non-neuromatous lesions may be extending plantar to the level of the deep transverse intermetatarsal ligament region, and they abut a broader aspect of the plantar plate. Why is it important to recognize that? Well, there's two reasons. Firstly, the eccentric pericapsular fibrosis is now recognized as an even more sensitive way to detect the presence of plantar plate pathology, so that it can help alert us at an earlier stage that there is increased compression at that area of the articulation. And as we spoke about in forefoot and rear foot biomechanics, this lateral aspect of the plate, or the fibular aspect of the plate, is one of the earlier areas to tear. So it's important to sort of notice whether or not we're getting greater increased pressure in this region, perhaps even at an earlier stage in the presentation. And that way, we can also avoid misdiagnosing and mistreating our patients that don't have neuromas, that actually have this pericapsular capsulitis that's eccentric in the interspace. So we know that neuromas can prolong pain and dysfunction and even permit the development of progressive deformities. So accurately identifying the difference between whether something is acting like a neuroma or something that's acting, in this case, like a pseudoneuroma is important to adversely impact